The American Public Health Association continues to be a leader in the public health world, staying abreast of the latest in science, data, and trends. And as we face the novel coronavirus pandemic, we need public health leadership more than ever. Today on APHA TV, we catch up with those very public health leaders and experts. Stay tuned. Welcome back to APHA TV. I'm Dina Baer, and we are officially into day 2 of this year's virtual annual meeting and expo. Before we begin today's show, let's do a rundown of some of today's virtual highlights. Be sure to check out the opening general session, stop by the virtual expo, click into the author meet and greet, and tune in to the first of daily feature films in the APHA Film Festival. Today's show kicks off with an exclusive interview featuring APHA's Executive Director, Georges Benjamin. APHA Executive Director Dr. Georges Benjamin is here now. It's nice to see you again.
Absolutely glad to be here.
We've made it to this year's annual meeting. Tell us a little bit about the challenges of making this year's meeting happen in this new virtual format.
As January 1st approached, we all celebrated, and then we were dutifully planning to have a great in-person meeting in San Francisco. And then, of course, as the pandemic began to reveal itself, we said, well, maybe we'll be able to have more of a hybrid meeting. So we began pivoting to a meeting where, folks would be in San Francisco, but we figured there'd be a couple thousand people that would have to watch this, our meeting from afar for one reason or another. And then, of course, as it progressed, we recognized very quickly we had to move to an all virtual meeting. That's been an interesting experience. We had to, obviously get out of contracts. We had to work with all of our critical business partners on making this transition and make some decisions about, how we're going to do it, what platform we were going to use, and ask ourselves, would anybody come? So it's been quite a transition, and I just got to pat both my staff on the back and our members on the back, because we're going to have probably close to 9,000 of your closest friends by Zoom. And by the way, this is not your cousin's Zoom meeting. This is going to be an amazing meeting with lots of stuff going on, networking. We're going to try to recreate as much of that face-to-face meeting as we can.
What are you especially excited about during APHA 2020?
I'm always excited about the ability to share new science, new experiences with others. In 1918, APHA, of course, was impacted by the great influenza pandemic. And that year we had to move our meeting in terms of dates. We went from late October to December. And that was quite an experience, as I understand it, for our members back then. But it was very important that the public health community work with the medical community to understand what was happening with the pandemic back then. And that's the case today. So we're pretty excited about the fact that we'll have the opportunity to really begin to figure out how we get this nation out of this terrible, terrible situation that we have ourselves. Based on science is going to be a very, very important part of the meeting.
How has COVID-19 affected APHA, and how is APHA working to continue succeeding past COVID?
The staff in COVID, obviously, we've, like everyone else, we've moved to a virtual working environment. And one of the things we've learned is that we can actually do it. But it has taken a toll. We found out we like to work with one another. We like each other. We're family. And the same thing with our members. So it has affected us in some positive ways in which we've learned how to work in a remote environment. And we think that there's an opportunity to build this kind of engagement so we can more actively engage members and the public in the future. But it's taken an emotional toll. But on the other hand, we have become very, very visible as a field, much more visible than public health has ever been. And we've taken some hits for it, but we've had some accomplishments. And it hasn't all gone smoothly, but APHA has been right in the middle of everything that's happened. And we have been a real force in trying to move this nation forward in addressing this pandemic.
Let's talk a little bit about how racism is a public health issue and the effect it's having in today's climate.
Well, let me get a shout out to past President Kamala Jones. As some of you know, during her presidency years, she made this a quest for her. And she laid the seedwork for this. And now we're tracking as an association many jurisdictions which have declared racism as a public health problem. We think what it's done is it's raised visibility. The tragic murder of George Floyd, of course, precipitated a lot of the national effort around this. But again, it shows that APHA is right in the front at the right time to make our case around racism and how it impacts people. And if you look at COVID, at the end of the day, the root cause of the disparities in COVID is racism.
All right, now let's look ahead. Tell us about the plans for next year's meeting.
Well, the theme for next year is creating the healthiest nation, improving social connectedness. And that's a very important theme. We think about what we've been doing here during COVID is that we've been telling people to be physically distant, but socially connected. And so in many ways, that theme is going to be about the rebirth of America. As we emerge from this pandemic, APHA is going to again be on the forefront of leading the nation in a thoughtful way about how we care for one another, how we build a new social compact for health, how do we engage one another to support one another, and how we move from this terrible divisiveness we're seeing right now as a nation to move forward. And quite frankly, I'm very optimistic that the nation will do this and APHA will be right there as we do.
Let's begin today's tour of organizations doing amazing work in public health.
We realized pretty early on that we needed to create a team at Ohio State to address the COVID pandemic that cross-cut many different disciplines, not just basic science, but translational and applied sciences. And this center brings together 46 different investigators from 5 schools.
Now, I think as a center, we really want to zero in on racial inequality and racism as sort of a locus of health equity that is especially important because it's clear in the contemporary moment that that matters.
Welcome to the APHA 2020 Annual Meeting and Expo, our first all-virtual annual meeting. Just like our in-person meetings, this virtual meeting is a mix of poster, roundtable, and oral scientific sessions, plus networking and engagement events. To make sure that you don't miss a minute of the action, let's go over some of the basics of our easy-to-use annual meeting platform. Right now, we're looking at the meeting homepage. You should bookmark this page for the week for quick access. Be sure to read the important information on this page. First, we need to sign in. You can sign in by clicking the Sign In button. It appears at both the top and left side of this page. In order to sign in, you need your registration ID and the email address associated with your registration. If you've already registered but don't know where to find this information, you can send yourself a copy of your confirmation, and if you haven't registered yet, you can do so by clicking Register Now in the box. Enter the information and click Sign In. Don't forget that APHA is very active on social media. Follow APHA and hashtag APHA 2020 on your favorite platforms. Include the hashtag in your posts to be part of the conversation. And if you run into any trouble during the meeting, don't hesitate to drop by our help desk. We hope you enjoy your stay at the APHA 2020 Annual Meeting and Expo.
Tools and techniques like machine learning and artificial intelligence can be used to inform in near real time the work that public health is doing.
We've built very large machine learning applications to really inform a referral to a provider, whether they are behavioral health, a social worker, maybe a dietitian.
Since the start of the COVID outbreak, the Regenstrief Institute's provided information to all the counties in the state through their dashboard. They meet with us weekly to improve it.
We're looking to put the right information in the right people's hands so that we can create a healthier world.
Hicieron Compromiso was formed by leaders who came together, 5 promotoras, and what they decided was that they wanted a group to represent them. They wanted to be able to come together and to build leadership and to support each other. And that's when the network was formed, the Network of Promotoras and Community Health Workers. And our name in Spanish is La Red de Promotoras y Trabajadores Comunitarios, which is the Network of Promotoras and Community Leaders.
At the very beginning, I think the impact that we had is really bringing people to the table, really bringing people to not only come together, but to start to do work in unison. Being able to bring to the forefront what the promotor model is, why it's so effective, and centering the promotor, and as a result, centering health equity and social equity along the way.
So this year, my APHA session is going to be about moving away from hate and violence, a way forward. I'm going to be talking about violence as an inflection point in this country as a result of the public execution of George Floyd. That currently, when we say public safety, people say police. And the reality is that police are only one aspect of the public safety process. My work has essentially been about putting the public back in public safety. And so we're reimagining the public safety system in reform that looks like a complementary strategy to law enforcement, as opposed to just investing more in procedural justice and de-escalation trainings for police. It's about really scaling and enhancing community-based public safety initiatives. So I came to this work as a part of my lived experience. I grew up in the Georgetown housing projects in Watts, and in the 80s, and I witnessed things that no child should ever be subject to. I watched the crack cocaine trade literally blow through my community like Hurricane Katrina, upturning families, destroying, households because of the epidemic. And the solution from the system was punitive. It was incarceration, without an investment in the trauma that was a result of the violence in the community. It was just allowed to fester and to ripple. Violence as a public health issue is not just a tagline. And we need, to create strategic partnerships to stop siloing our work in the field, so that we can figure out all of the connective points in which we work together in order to address some of the underlying issues and stuff that's impacting our community.
That's it for us today. But remember, we'll be back each day of the virtual meeting with more exclusive material. And don't forget to keep up with all the latest developments and get in touch with us via the web. We'll see you tomorrow, APHA.